Welcome, everyone. This is Lynn Kintz with the Hemophilia Council of California. The Hemophilia Council of California's mission is to improve access to care and treatment options in order to advance the quality of life for people with bleeding disorders through advocacy, education, and outreach in collaboration with our founding member organizations, which are the other patient groups here in California. And we are happy to welcome you to the presentation today. I would like to introduce Amber. She is with the Treatment Center in Nevada, and she's going to introduce herself a little bit as well. We're thrilled to have her here. She has spoken around the country on this topic, and I know is widely respected, and looking forward to hearing her presentation today about women and bleeding disorders.
My name is Dr. Amber Federizo. I am a family nurse practitioner and I treat the lifespan here in Nevada. One of the things I want to go over first is positively, sometimes negatively. There are people in the community who feel that if you get your terminal degree and you receive a doctorate, you should not use the title because it is confusing per se. And my response to that is that every moment is a teachable moment. So I have had to re-educate people that a doctorate just means that you have finished your terminal degree. Archaeologists are doctorates, physicians are doctorates. We have to start using the correct terminology, including physicians. So physicians should start talking about, hey, I am Dr. So-and-so, I am your physician. As I do, Dr. Amber Federizo, I am your nurse practitioner. And there are people in the community, sometimes the more you need to tell them who you are, you have to repeat yourself several times, and you sometimes reach a point where it is frustrating. And so I think that that has given me some insight and improved my ability to help patients advocate for themselves. So I'm going to go through a couple of things that I'm hoping will help you to improve to advocate for your care as a female with a bleeding disorder. So who does the world believe you are? As a female with a bleeding disorder, I'm going to be honest with you, the nation for a long time didn't even believe that you existed. Even when we were going through the contamination crisis, we were focused on the fact that we were losing our brothers and our sons, and we forgot that there were women who also died along the way, and that they, although they survived, they still survived that same period in time. Flash forward to where we are now, and the world is starting to see you, but there are still those in the world who don't believe who you are or what you suffer from. And that has been probably the most frustrating thing for patients, is though they are starting to realize, you know, they have been there. The world is just starting to begin to understand that you've been there. And we are at a disadvantage. If we were talking about a different disease state, we would still be having these same struggles. If you are female in the United States, there's a stigma that we are, exaggerating our symptoms, that women are emotional, that we have inability to think objectively. And that's unfortunate, because even if we didn't have a bleeding disorder, the world would still believe that as a female, we shouldn't be listened to. Also, the world believes that you're a mom, and with a mom, that brings different stereotypes. When a mom murders their children, it is seen very differently by the jury than if the father did, although both are extremely egregious. You're an employee, so people make judgments based on where you work. You look at perhaps a fast food worker and you think, well, they didn't get opportunities or education, and so we predetermine and prejudge what the world believes of who we are. You're a sister, and with that becomes also obligations as well to your family. Sometimes families have different obligations that they do with females that they don't do with the males in their lives. And so the world has already decided who you are, and it's kind of up to us. Like I said, every moment is a teachable moment, even if we get to that frustrating end. So fear. This is pertinent now more than ever, perhaps in the time that we are facing. Fear is healthy in small doses, but in larger ones can become counterproductive and actually lead to self-fulfilling prophecies. The things that we don't want to occur can very much occur due to fear. For example, in our current state, many patients have made different decisions, and families have made different decisions and gone to the grocery stores en masse and have taken everything off the shelves. And unfortunately, that's exactly opposite of what we wanted to happen. We did not want people going en masse, being together, lacking social distance, and removing everything from the stores, leaving the most vulnerable of the elderly to try to find what they needed to on their own. But that's a great example of how fear has kind of chosen a self-fulfilling prophecy of leading to options that were not ideal. The same thing happens in disorders in medicine. We fear what may happen next. We fear what will our provider think if we say X, Y, and Z? What will they think if they say, if they knew perhaps that over the last few years I've taken my kid's factor because I didn't have any other access? What will they say if I tell them I have symptoms? Do I fear that they will not believe me? So fear guides a lot of the decisions that we make.
Thank you, first of all, Amber, so much for your time and for that excellent presentation. Thank you all for joining us. This series is part of a series of educational webinars that the Council presents. We will have the recording and the slides available in a few weeks on our website. And we will have more webinars coming up. We're looking at sort of adjusting to the new reality that we're all facing right now and seeing what information would be most timely to provide to all of you. So watch your inbox for more information about what the new topics will be coming out in the coming weeks, and we will send that information out. You can also find it at our website at www.hemophiliaca.org, and you can sign up there to be added to our email list if you're not already on that list. So thank you all again so much for your participation. Thank you again, Amber, and we hope that everyone stays well, and please, if there's anything we can do to assist you, don't hesitate to reach out to us at the Council. So thanks for joining us today. Bye-bye.